Welcome to this segment of Live Healthy with Memorial Health's Dr. Evan Seigall, discussing sprains and fractures in young people.
Sprains and fractures are very common in children, especially those who are very active and do a lot of athletics or other activities. Typically they heal up very well and they get back to doing all their activities like normal. Because kids are so active, re-injuries and re-fractures certainly can happen as they get back into activities. Developing bones in pediatric patients or children are quite different than adult bones, and their injuries are treated differently as well. So seeing a specialist who understands how their bones are growing and developing is worthwhile to make sure they get the best treatment they can. Frequently, injuries in children do involve their growth plates, which is a layer of cartilage in the bone which allows it to expand or grow over time. These are common because that is an area where the bone is somewhat softer, and so if they're going to get injured somewhere along that bone, it's a likely place. Typically, growth plate fractures or injuries do heal quite well and do not alter their growth at all, but they can and require appropriate treatment and monitoring to make sure they don't. With the recent pandemic, a lot of kids have been out of their sports and activities for some time. It's important to stay active, but also as they get back into their previous level of activity, it's important to warm up and stretch, and having been out for a while, some of their previous activities will be a little more difficult for them until they build back up their normal strength and endurance.